Hi, everybody. Welcome to another episode of SOMA Living. I'm Dr. Leif Rogers, plastic surgeon.
I'm Dr. Walter Joseph, plastic surgeon.
And today we're going to talk about sort of regenerative medicine and sort of wellness, longevity, how it applies to plastic surgery, aesthetic medicine, and just overall well-being.
Right. Yeah. So I think that, well, for me, I think what the cool part of my journey in this kind of with all these topics is that, I mean, so much of it I learned from you and just being a part of this practice. But you kind of catch a little bit of a bug with it and you just kind of dive in. And that's kind of the process has been for me.
Yeah.
But maybe you can share, Dr. Rogers, kind of what got you into it.
Yeah.
Because obviously that was so inspiring for me. So
it's so my introduction to this actually, I have to admit, was actually from my patients. So I had a couple of many years ago.
Yeah.
I had private practice, plastic surgery, just like lots of other plastic surgeons, and I was doing a lot of body contouring back then. I still do some, and so we were doing lipo on these patients, pretty large volume lipo. And I had this one patient who I had previously lipoed a number of years before, and she'd come back to me, and I had done more lipo, significantly more, different areas. The first time, she swelled like crazy.
Yeah.
She's like, okay, you're just a sweller. And so when she came back the second time, I'm like, remember how much you swelled last time? Expect that. That's gonna happen again. She came back to me after like a week, and she had like almost no swelling.
Yeah.
I'm like, what's different? What are you doing? Why is you have no swelling? I know you're a sweller.
What's the X factor?
Yeah. So she said, well, I started doing cryotherapy. I'm like, huh, interesting. I'd heard about it before, and I had some friends that were like in the whole MMA world, and that was kind of a thing then. I'm like, this sounds...
And when was this roughly? Like what year, say? Just to kind of put it into
this was probably
reference.
2012, maybe?
Okay. Yeah. So like over 10 years ago.
Over 10, maybe even before that.
Yeah.
So it was, and I started looking into cryotherapy. Initially, I'd heard about it, so I'm like, this doesn't make any sense. Cold, what's it going to do for you? But then I looked into it. I'm like, okay, there's some actual data. Started looking up the papers. I started looking into other technologies that seem to have some data behind it.
Yeah.
So then I started looking into like PEMF, pulse electromagnetic field therapy, and red light therapy, and all these other things. Then I started looking into peptides and hormones we already knew about, but that was becoming bigger and bigger. And hyperbaric oxygen therapy, and the first time I was introduced to that was actually back in residency.
Yeah.
So I trained at Columbia in New York, Columbia University, and they had hyperbaric oxygen, but most of the surgeons didn't believe in it.
Yeah.
I mean, we sent them, and it was mostly for like these diabetic foot ulcers and things.
Yeah, yeah.
And but we're also doing like whirlpool therapy and stuff, which I don't think they even do anymore.
Right.
So anyway, so it kind of had like a moment. And then a lot of people just like, it's not worth it. Hospitals actually removed a lot of their hyperbaric chambers. But I'm like, there's data here.
Yeah.
And so over this period of time, over the last more than a decade, the data has been accumulating.
Yeah.
And there's more and more evidence to show that all these things actually have an impact.
Yeah. A lot of these things initially when they came out, or they were not fully accepted by the medical community. They were kind of viewed as voodoo, snake oil, all these things.
Very much so. Some of them, and a lot of them still are by some people. But it's become much more widely accepted.
Yeah.
Because there's science. I mean, you can't refute that. I mean, you look at the papers, you're like, oh my God, this is measurable. And here's another paper that shows the same thing.
Yeah.
So it is real.
Yeah.
And then what motivated me to actually develop a center. And I started the whole process probably very shortly after I started really looking into it. I'm like, because I had patients who are going to different places. I was sending them to different places to get therapy so they would heal faster. Yeah. And I'm like, and they're like, oh, it's just too many places.
Right.
I want to do it, but
it's
like
a whole rigmarole of.
So I said, okay, I need to build a place where they can get it all.
Yeah.
And so I built one in Beverly Hills. And it was a standalone center, and it was all pretty and everything, had all the bells and whistles. But I realized very quickly that it wasn't ideal. And because it was not actually part of my actual office, my practice. And even though it was just across the street, it was still another location, another appointment. So I'm like, okay, all right, this is going to be challenging.
I feel like that's such an LA thing, right?
Yeah.
Like, even like someone who's living on the west side, like can't date someone who's living on the east side. It's almost like that same concept of even a block away in LA. seems like just
Yeah.
too far.
But it is a pain.
It's
I mean,
true. No,
I mean, especially if you want to move your car, you have to deal with parking.
no. I mean,
it's
there's
just
yeah.
And so, and it's Beverly Hills, and people Beverly Hills is a kind of a pain in the butt to get to anyway. There's no close highway or anything. There's always bad traffic. So I get it. So we decided to build. I was in the process of building out a new office in Pasadena anyway. So we were moving from one location. I needed more space. So we found this space we're in now. And initially, I'm like, 11,000 square feet. How am I going to fill this? Like, well, we're definitely going to put in a healing center. And so we built it all out in one place. So now we have, my practice. We have the non-invasive, like aesthetic stuff with the lasers, injectables. We have a surgery center. We have aftercare, which is a place where you can stay after surgery, where nurses literally watch you for as long as you want. And like, it could be a night, it could be a week. And we have the healing. It originally started as a healing center, but now it's healing and longevity, because longevity is kind of the new hot thing that actually has data now. Again, data. When I started with the healing center, there was no data in longevity. There's real data now. Any case, so the nice part is you get to stay here and you get wheeled across the hall, not the street. And you can get hyperbaric oxygen, you get your IVs, you can get red light therapy, cryotherapy, like Balancer Pro, which is a compression type therapy for lymphatic. You have lymphatic massage therapists. And we have Dr. Brendan Corneen, who's our medical director. He's a naturopath, but he's so incredibly well trained.
Brilliant.
And he knows like the endocrine stuff as well. So now we can tune you up before your surgery starts. You can help you heal after surgery, and you can keep doing some of these things essentially indefinitely if you want to maintain a higher level of well-being.
And I think when patients come in to see us in consultation, it's so cool to be able to tell them that where you are right now is where you're going to get surgery. It's where I'm going to see you for your follow-ups. It's where you're going to go for all these additional treatments that'll help your recovery and your follow-up. And they love that. They love that it's a one-stop shop. They love that they can just walk down the hall, and it becomes like a little home away from home. They meet the staff and all the different staff. They meet Blanca, our hyperbaric tech. They meet, our massage therapists. They develop relationships with all these different people throughout all of our facilities. And it truly becomes like a little home away from home, and they love it.
Well, let me tell you a little story too. So back in residency, so I trained quite a few years ago. And back then, this is really the early stages of digital photography. And so prior to that, especially in New York, all the cosmetic surgeons in New York, they would send their patients to a photographer for their before and their afters. There's a whole nother thing.
And we used to do that in residency. We used to do that in residency. They'd have to go to the photography department.
And so you would literally go to a photographer. They take all your pictures. I mean, trust me, the pictures were really nice. And then you literally take photos, and put them up on the board. I know. And so you can look at them during surgery. So that was the very beginning. Like, okay, we're going to take our own pictures, and then how do you get good, consistent pictures? So that was just the first step of all right, how do you perfect this one thing that's not what your core,
which is a hard thing.
And so each little thing is it's a whole other thing. So what we finally ended up with here, in years of different iterations of photography, we have what makes the most sense for us, a photo room. It is a room in the practice. It has its own photography system. So it's got this thing that spins around you. It takes 360 images in like a second, 2 seconds. OVO, which is a great system, by the way. Anyone who's looking for a system, it just takes up a little space.
It eliminates the human error, right? So it takes 360 photos and a movie. And every single angle. So it literally spins around the patient. It's like those, at parties or like events where you stand on that platform and everyone makes different poses and there's that camera that spins around you. It's literally that, but medical grade, and designed for patient photos at all different heights. And
so all you have to do is make sure the patient stands on the X and is in the right position, the head, and that's it. The rest is done. When we also have Vectra, and that's been around for a while, but this is the new iteration of it. It's the H2. It's a 3D camera. But the nice part is, again, this takes out some of the human error. The old one would take one shot, multiple angles, but kind of stitch it together. This one, you can kind of go around and you can stitch it all together. So these are the ways that we figured out how to get the most consistent photography. And that's important because especially these days and with marketing, you need to show this stuff. Patients want to see their own pictures. They want to see other people's pictures. So it's very, very important in our world.
And also, as plastic surgeons, we're obsessed with the photos because that is how we critique ourselves. Like we both, I mean, I know we both do. Like I will sit down, you know, at the end of a clinic and look at all my patients before and afters and study them to really critically, you know, down to the tiniest little minutia, analyze their before and after and decide, oh, could this have been done better? Could this have been done better? Oh, this what nailed this. Maybe, you know, maybe didn't nail this. Maybe what could I do next time? You know, we're always trying to get better, right? And so I think that's the photos for us are so important.
And you need consistent, honest photography for that.
Yeah.
Pay attention, everybody. Consistent, honest photography.
That's another episode.
Totally different. Yeah. Sorry, so let's go back on. Let's start talking about what we want to talk about, which is the whole regenerative.
Yes.
Okay. So regenerative medicine is a new thing. It's becoming the standard.
Yep.
And for us, the modern aesthetics, but it is becoming the standard. So there's so many things in aesthetic medicine, and not just aesthetic, but also mainstream medicine for all kinds of things, where regenerative therapies are becoming the norm.
Yeah.
They are the cutting edge, but not only that, they are actually becoming accepted as the standard for many things.
Right.
So for the aesthetic world, we have all kinds of therapies that do make a difference. So there are simple things like PRP, so that's platelet-rich plasma, where you draw your own blood, you spin it down, you take the platelets, and you inject into various areas. The platelets produce all kinds of growth factors that help upregulate stuff that improves the tissue quality. So from that, there's a new company that came out. Now they're doing PDGF, platelet-derived growth factor, one of the main growth factors from PRP.
Yep.
So you can buy it as an isolate now.
Yeah.
So you can use that, and that's pretty cool.
Yep.
Of course, there's stem cells and exosomes. Those are things that are sort of in a gray zone because of the FDA, but there are totally legitimate ways to use it.
Yep.
And there are some interesting effects when it comes to that, regenerative effects. It turns on processes within your own body, your own cells, to upregulate stuff, to make your skin thicker, to decrease inflammation, probably the most important thing, decrease inflammation.
Yeah.
It can help with all kinds of stuff, not just aesthetic, but overall well-being, whether it's your knees hurt. I mean, for osteoarthritis I mean, we have anecdotal stories of all kinds of things that it seems to help with.
Yeah.
So physiological things.
Yeah.
So it's, and that's literally the tip of the iceberg.
Yeah. And then, you know, like we touched on, and then so all these other different modalities that we're learning more and more that they really make a difference in terms of kind of resetting the clock and bringing, you know, sleeping dormant cells out of what we call like senescence. So waking up these cells that were maybe doing nothing in the body, or getting rid of cells that are doing nothing. That's called autophagy. So there's all these different processes that are being harnessed by these devices and these treatments. So you want to increase autophagy, you want to decrease senescence. So all these different processes that work together that really are evidence-based to make us live longer and healthier you know. I mean,
in like, for a less technical term, kind of reverse aging almost, because part of the aging process, it's complicated. What is aging? So that's a whole other thing.
Yep.
But the part of the things that do interfere with how well our body functions and add to the aging is chronic inflammation. But what causes that?
Right.
So they're senescent cells you talked about. They're basically they're not dead, but they don't really function. They get in the way. Right. Getting rid of them, it's like getting rid of the roadblocks in the road, so the highway flows properly. There's that stuff. There's your stem cells. Your stem cells, as we age, we have fewer stem cells. So that's kind of our backup. When cells die, and they normally do, apoptosis, they have a certain lifespan, they die, they get replaced. A stem cell has to divide and differentiate into that type of cell to replace it. So that's our bank. So when our bank starts to slow down, we don't replace as many. And that's a problem. So there are ways to upregulate your stem cells. Stem cells have a certain number of divisions, and that's based on a couple of things, but one of which is your telomere length. So that's a little string of DNA, and every time your cell divides, it cleaves a little bit until there's none left, and that's it. So there are certain things that have data that show it lengthens your telomeres, like hyperbaric oxygen therapy, for instance, and other things. So that gives you more divisions. So theoretically, more divisions, more cells, more life. So it's really interesting, very interconnected, very complicated, but in some essence also kind of simple. Like there's certain things you can do that can improve homeostasis and regulation, which in essence makes everything work better.
And I think people are drawn to these treatments because a lot of them are kind of non-invasive. They're natural. You know, it's not about like sticking needles into your face and making yourself look younger. It's actually like reprogramming your insides.
You actually are technically younger.
Yeah.
You're functioning as a younger person.
Like things like red light. People are, you know, the red light market has exploded because there's good data. It works.
It works.
And people are seeing changes in their skin from things like red light masks or red light booths that comparable to say like Botox, you know, and they're doing lasers that are also reversing skin aging that, you know, it's taking the place. And that's why a lot of these injectable companies are struggling a little bit to keep up with that.
Yeah. The smart ones are actually start like developing regenerative products, you know, getting into that area. Because that really is it's the future. It's the future of medicine in general.
Yeah.
And fillers, I mean, obviously there's still a good place for fillers, but they make sense. The HA fillers, the hydroxyapatite like Radius, the PLLA, I guess, or PLG, PGLA. Yeah, like Sculptra. But there's new ones like Renuva, which is not a filler per se. They call it a treatment, but it is it's collagen and growth factors, and it turns on certain cells in your body your body will populate this matrix with its own cells and grows fat. So it acts like a filler temporarily, but it's not really a filler.
Yeah.
So this is where things are starting to cross over.
Yeah.
So it's very interesting.
Yeah.
It's very fun because it's constantly changing.
Yeah.
I'm very glad I went into medicine.
Yeah. And I think it's, I personally love, and I think our patients love this idea of optimizing themselves.
Yeah.
Whether or not it's what we call like prehabilitation before surgery, you know, of course we have everything, you know, in the sun to kind of prehabilitate and optimize yourself before surgery and then during and after. But even if you're not doing surgery, to optimize yourself and give you the best modern, you know, life that you can. And I know great instances where someone had some, you know, was feeling older than they were, feeling less energetic and just feeling off, right? And so I think more and more we're learning that there's real reasons for these things, and whether they're hormone imbalances or different, you know, just intervening in different processes, inflammatory processes in the body. And now there's all these peptides that can, you know, modulate those systems. And, you know, we're seeing noticeable changes in our patients, and our patients are feeling these improvements from the inside out.
And in ourselves, by the way.
Yeah.
So it's, you know, I think forever, everyone says, oh, you know, as you age, you're going to feel this, you're going to have more pain, you're going to have lower energy, and all that's true. But we don't necessarily have to accept it anymore.
Exactly.
You know?
Yeah.
So there are things we can do to actually improve that.
Yeah. And why not?
Yeah. And this is all in the same vein as cosmetic surgery, or even, you know, getting your knee scoped, for instance. You have pain in your knee, you want to fix it so you can walk properly.
Yeah.
It's the same kind of a thing. You look at yourself in the mirror, oh, I look tired, I need to look better. When you look better, you feel better.
Yeah.
But now we can actually truly make you feel better from the inside out, physiologically, from the cellular level.
Yeah.
Which is really interesting. And it's just a continuum as to what we do.
Right.
And why we developed this center, why we have the standard of modern aesthetics, and we have, and why it's an all-encompassing experience.
It's all intertwined. You know, I know we've had like the whole vanity conversation before, right?
Yes.
About, you know, there's an element of vanity that's part of plastic surgery. That's, you know, you can't deny that.
It's not a bad word.
No.
Though people want to make it a bad word.
Right.
It's not.
And I always say, like, I think vanity is actually a protective measure.
Absolutely.
You know, in terms of wellness and longevity. I think it is. And so, you know, something just popped into my head. I think, you know, so much of what we traditionally think of vanity as being external or appearance, but I feel like now there's this new like internal vanity, right?
Yeah.
Especially with all this regenerative stuff.
Like what's the guy who's trying to reverse
like Brian Johnson?
Yeah, right. So that is internal vanity.
That's like, internal vanity.
Look at my, you know, my age, what does he call it?
I know what you're talking about. Like the cellular age.
So it's like, look at my cellular age. I have a cellular age of a 24-year-old. You know, so I mean, it's like they're bragging rights.
Yeah.
But,
Yeah.
hey, we all, why do you wear nice clothes? Why do you care? Why do you put makeup on? Why do you drive a car that you like? You know, and people typically pick cars that they feel reflect them.
Right.
Right. Well, what reflects you more than you?
Yeah.
So obviously we should be taking care of ourselves, not just buying stuff to look good, but potentially spending some of this hard-earned income on being better from the inside.
Yeah. Yeah. And then feeling better. And then it all, I think a big thing is if you're changing the inside, then it'll translate into the outside too.
Of course.
Yeah.
Absolutely. I mean, why are young people pretty?
Right.
Because they're young,
Yeah.
right? Because all the tissues are healthy.
Yeah.
And so this is why we all strive for that. That's why it's such a coveted thing in most modern societies.
Yeah. And I think even, this is a little bit of a tangent, but this kind of all goes back to like lifestyle and how this all wraps together. I think one kind of interesting fact about kind of Gen Z, right, is and just the current climate of, say, like alcohol.
Oh, yeah.
Like the alcohol industry is like
point.
suffering major right now because younger people just aren't drinking. And I think a lot of it just has to do with them realizing that it's not the most healthy thing.
No.
And it can have an impact on not only the inside of your body, but your appearance as well.
Yeah. Everything you do impacts your health and impacts who you are, like what you're made of.
Yeah.
So what you put in makes a difference.
Yeah, right.
So, I mean, we choose, like, do I have a glass of wine or whatever once? Of course I do. But you think to yourself, all right, what's the negative? What's the positive? And you kind of, at least I do. I weigh it in my mind before I do it.
Yeah.
Is it worth it?
Right.
Sometimes it's worth it. Sometimes you want to have whatever it is that you know you're going to enjoy, but it's not the most healthy thing.
Yeah.
As long as you're balancing it
Right.
with something else.
Yeah.
So it's, life is not about purely optimizing, but it's about enjoying yourself.
Yeah.
But you want to enjoy yourself, optimize, and do it for as long as you can, right? Not run yourself into the ground.
Yeah.
So we want to be here as long as we can, because as far as I know, there isn't another life after this. You can believe in one, but we don't know.
Right.
So let's optimize the one we have.
Make it great now.
Yeah. Yeah. All right. So as far as our own personal routines, well, I know you.
Yeah.
Yeah.
So, I mean, I love this topic. I mean,
Yeah.
this can be its own episode too, eventually. But one thing that has, I think, dramatically affected me in the last year and a half, I've probably been doing it, is NAD injections. So religiously, I've been injecting NAD twice a week. So I do 100 milligrams twice a week. And I think it's just dramatically changed my skin, my immunity, my energy, clarity.
Do you find that the energy is sustained between the shots, or is it kind of like a peak and then it drops?
Pretty sustained, because I do twice weekly injections. So, and religiously, like my NAD is on Sunday and Wednesday. It's just like,
and have to start that.
I think it's made a huge difference. More recently, I added glutathione in.
Okay.
So glutathione can be given either IV or NAD as well. So you can administer these through an IV. So if you come here, you can get an IV. And usually with glutathione, we'll follow your IV with like a 10 cc push of glutathione, which is a pretty big dose, but it's effective. Or you can do like, more kind of weekly to daily dosing. And so I've also been doing 200 milligrams of glutathione twice a week.
Okay.
Injecting that.
Okay.
So glutathione, both of these are potent antioxidants. Glutathione, a lot of liver support, also good for immunity. And there was a period like about a year and a half ago where I felt like I was getting sick like every couple months.
Yeah.
I feel like knock on wood, I feel like I really haven't been sick since I like started these things.
Right.
Which
That's
is pretty
great.
cool.
It's
Yeah.
amazing.
Yeah. So those I'd say are like kind of my like fountain of youth.
Yeah. Well, I'm 55, right? So one thing I started a few years ago was TRT.
Yeah.
I do a very low dose,
Yeah.
but it's enough to get my levels up to normal physiologic levels.
Yeah.
That's made a big difference for
Yeah.
me.
Oh, absolutely.
So I keep my muscle mass. You can see, obviously I work out, but I don't have to work quite as hard.
Yeah.
And I get less injury because of it. Like I noticed before I was kind of lower energy, kind of achy with my workouts. I wasn't seeing as much gains.
Yeah.
Now it feels more like it was when I was like 30.
Yeah. Right. And I think it's an important distinction too, just to clarify for everyone. So TRT is testosterone replacement therapy. So this is not like bodybuilding doses of testosterone. Right. So also personally, I am on TRT as well. So, I mean, this when I got out of I think after I finished my fellowship, I got my blood work done
Yeah.
here, and my testosterone was like the level of an 80-year-old.
Yeah. And this is an epidemic, by the way.
Right.
Young men, at least in America, I don't know about anywhere else, have chronically low testosterone now.
Yeah.
And there's all kinds of theories of why this is happening,
Yeah.
but it is happening.
Yeah. And I
So-
think it was a combination of just being out of residency, probably like extremely poor sleep for 6 years plus, and just the stress of all of that. And, so I think my level was like 230 or something.
Yeah. Yeah.
And so I've been like a different person on that too. And I've been on that since. And there's ways to, we'll go into this, I'm sure, in a different episode, but there's ways to mitigate the, effects on sperm count and whatnot. If you are interested in having a family and child and, getting pregnant and whatnot, there's ways to kind of mitigate for the effects of that.
So we can, all these things are manageable.
Yeah.
And it's not like back in the day when, it was only the bodybuilders doing it in crazy amounts.
Right.
These are normal levels, with levels that honestly young men should be.
Right.
So,
and we monitor, right?
Yeah.
That's another thing. So we do the blood work. We have a whole system here. We have a whole team here that monitors all of that.
Yeah.
So these are not like willy-nilly decisions. These are calculated dosages. These are measurable, and they're monitored.
and based on blood work.
Yeah.
So like this is the way it should be. So
Right.
if you're going to go down this path, it's best not to just like, let's try this, let's try that. I heard this on a podcast. Let's do it. So no. So what you should do is you go to a doctor who knows what they're doing.
Right.
And we're not the only ones. There's a lot of people out there who really have focused on this. And so you find a person who you think is good, or obviously hopefully someone has referred to you and had good results. They will do a panel, meaning they'll do a bunch of blood work, measure a bunch of things, see where your blood levels are of various things.
Yeah.
And if anything's a little bit out of whack, and almost everybody has something that's a little out of whack, we correct it. And then we do another test at some point down the road to see if it's been corrected properly, make sure you're not too high or too low.
Yeah,
still.
these things have to be like carefully titrated. It's not just this, shot in the dark dosing. Like we're precise. It's measured and monitored, and we're like sticklers about that. And Dr. Brendan is amazing with that, and he'll be on here too to talk about all this again.
And the truth is, if you're young and you're healthy and you have no symptoms, you don't need this stuff. But if you want to improve yourself in some way, like something measurable, you have a goal, or if you do have a symptom of some kind, that's really the people who benefit the most. And we do have, having said that, we have patients in their 20s who honestly probably don't need it, but they do want to know that they are maximizing themselves.
Yeah.
And there's nothing wrong with that.
Yeah. I think I had a friend who had just quit. He was just quit drinking, and he thought that was gonna kind of help the way he was feeling. He was just feeling down, feeling a lack of energy, just feeling like he just wasn't enjoying things in his life. And he was like, "Okay, I'm gonna stop drinking and see if that." And then he's sober, and he's like, "Just something is still off." And he got his blood work done, and his testosterone was low. And this is the first time that anyone had even checked his testosterone. I think that it's a hugely missed thing.
It's not typical. In young men, most people don't test it.
Yeah. And his levels were on the low side. He started on TRT, and it changed his life. Yeah. So it changed his mood. It changed his overall feeling about his interests and excitement about life and his energy and his everything, And so I think so often we jump to like psychologic meds, for like antidepressants and anti-anxiety medicines because of certain symptomatology. But, more often than not, there could be something else going on that's
something real.
I feel like missed a lot of times.
So another thing, we have other technologies too. So the early stuff I looked into, like the red light therapy and cryotherapy, hyperbaric, those, by the way, are amazing. They really do work. And those are for everybody. So you don't have to be someone with an ailment to use those. You can be 20. And it will upregulate certain things to... I'm not going to say it's going to make you superhuman, but it's going to make it's going to boost your abilities in some ways. Yeah. So it can increase mental clarity, hyperbaric oxygen. It can help with all kinds of things like hangovers, of course, and jet lag and sleep issues and things like that. It's good for post-op healing, of course. And then red light therapy. Red light therapy has all this data for again, wound healing, inflammation in general, hyperbaric also for inflammation. There's some data to show that it can improve hair growth because it increases microvascular circulation. It increases cyclic AMP production, which is ATP production rather, sorry, and which is part of the mitochondrial citric acid cycle. It's what your cells use for energy. So it can also improve your gains at the gym. So for those people who are really into the gym and you're trying to, like, say you're getting ready for a marathon, you want to just get stronger. If you do red light therapy, red and infrared light therapy right after a workout, you will have more gains. And that is proven. Yeah.
And red light before any type of exercise or performance activity increase performance.
Yeah, a little bit. But the biggest benefit, according to the data that I've reviewed, is to do it immediately after a treatment. And you get more gains so that your performance improves the next time afterwards. It's also, I'm sorry, what's something else for red light? Inflammation. Oh, red light therapy is also good just for skin inflammation. So like if you have acne or something, it's actually very good for acne. We have a booth also that is blue light. Blue light's a little bit different. It kills bacteria, so that helps in a different way. But these things really do have a measurable effect. Lymphatic massage, lymphatic and sports massage, both.
Huge.
Makes a big difference. So lymphatic massage is good if you have extra fluid in your system and it helps get it out. It's good for post-surgery. It's good for lymphedema, of course. That's where it all originated from. But it is good in general. But we have therapists who also can do sports massage. So sports massage is great for athletes to get blood flow to the muscles. And this stuff's been around forever, but it has real measurable outcomes.
And it's all here. It's down the hall.
Yeah, exactly.
So you don't need to go anywhere to make appointments. You don't need to coordinate all your visits. That's what's the beauty of our center.
My biggest challenge and my number one goal for me right now is to use my own center more. I built all this stuff. He says
this all the time.
I do. I mean, I really built it for me. I mean, the real reason is I built it for me because and like when I recognized that these things worked, I was I was like early 40s. I'm like, it's coming. I need something. And so, so this was really for me, but of course everyone gets the benefit. So on top of all this stuff improving your life, and of course it's good for pretty much anybody. Anybody can come and benefit from it on one level or another. We also use it. And the main reason I built it again was because of surgery. So that's where it started. It's not where it is now, but it is part of it still. So the vast majority of my patients who come in who want surgery, especially the bigger surgeries, not talking about the little tiny things, but the bigger surgeries, I recommend a regimen of a before and after with the healing center. And what that usually looks like is bare minimum hyperbaric oxygen before and after surgery. It improves outcomes, decreases complications, but it also is part of the tune-up. So what's the term you like to use?
The prehabilitation.
Prehabilitation, right? Yeah. So it's I'm a little more simple. Tune up, tune you up for the surgery. So, but the idea is get you optimized for surgery. So your body is ready for this injury that's coming. Because that's what surgery is. It's an injury. So you can tolerate this injury the better. Your body can heal from it better, and you can have better outcomes. So part of that actually comes before, and then part of it after the injury. You do more to help you heal from afterwards. So it's a whole regimen. And those who are interested in doing it, it's not an absolute necessity. You don't have to do it because frankly, your body will heal, but you will benefit from it. The whole pathway will be easier and the outcomes will be better.
I always tell my patients, if you're really trying to like expedite and you want to heal as quickly as possible and have little downtime as possible, you can do all these things and it will make a significant difference. So it's up to, it's up to them. We obviously recommend that. I think in general, the shorter the healing time, the better. Healing is an inflammatory response. And so if we can kind of cut that down, then everyone wins. But so not only do these things kind of affect all that, but I truly do believe that a lot of them enhance our results. So one of the things that has really enhanced my results is like lymphatic massage. So especially with lipo. If I've noticed a significant difference in patients that get liposuction with me and who are diligent about booking lymphatic massages at least weekly for the first 4 weeks after their liposuction operation, I think they have significantly better results, more even results, less irregularities, less bumps, less need for any revisions, and just an overall smoother, prettier, less scar tissue, less fibrosis.
So I think that's the big one. You have less scar tissue. So that's something I don't think I realized early on. I'm like, well, what's the difference? Cryotherapy works really well too.
Right.
It does for swelling, but it doesn't necessarily address the fibrosis that starts to happen. But I think lymphatic massage does.
I think in general, we say these things to our patients, and in my head, sometimes I feel like they're like, oh, here he goes again about like the scar massage and like things like that. Yeah. But these things really work. And these things we don't just say these things to say them. They're actually evidence-based. I always tell my patients, I'm not just telling you to push on your scar just for no reason. There's real scientific data, like physics data on scars responding to pressure, and there's different pathways that are activated just from pressure on a scar that help the scar remodel and will improve the appearance of that scar and not make it hypertrophic or, so the things we say, I feel like we repeat these things to our patients, but they really do have a reason and a meaning and, they make a difference. It
matters to me very, very much. Anything that I put into this center here has data. I did not want to put anything that was equivocal. There's some things out there that may work. They may be amazing, but they don't have the data yet.
Yeah.
So I'm not willing to commit to something that is purely based on someone said it works.
Yeah.
So anything that's here, you can absolutely guarantee that there's data to support it.
Right. And I just wanted to mention too, all of our surgical patients, we've been offering a complimentary hyperbaric oxygen therapy treatment as part of your surgical package. So that's another, added value to our practice. And that's not just to optimize your outcome, but it's to allow you to experience this side of things and hopefully get a taste of this whole longevity, wellness, anti-aging kind of process.
Yeah. I mean, it's the whole world of wellness, longevity, healing, anti-aging. I mean, the idea has been around for a while, but I think so many people don't truly understand it yet. Now there's a lot of interest. That's why some of these big podcasts based on this are so big. I mean, because there's a lot of interest. Being interested and actually taking that first step can sometimes be miles apart.
Yep.
So
it's so true.
If we can help you at least understand it and then maybe take that first step so you see what it's all about, whether you stay with us or find somebody else, it is a journey that I think is worth doing.
Yeah.
And it will make your life better.
Because I think when patients come in and they maybe do that one hyperbaric complimentary session before their surgery, then they realize, oh my God, that sleep that I had after that hyperbaric or that energy that I felt the next day and that clarity, it's like a little bit, it's the same thing. It's like just getting that, like that, catching that bug and like getting that, that taste, and they want to keep doing it.
Yeah. I agree. I agree. I want to keep doing it.
We all do.
All right. So I think we're going to wrap up.
Yeah.
So that's in general what
brief overview
of what we do, the regenerative aspects of things, what longevity and wellness kind of looks like as it applies to plastic surgery and just, life in general in modern times today.
Yeah.
And this is what we're aspiring to try to provide for everybody. So thank you for watching. Again, if you guys have questions or other things you want us to talk about, please just submit them. And this is yet one more episode of SOMA Living.
Yes.
And we will see you next time.
See you next time.